Hello and welcome to the Happy Artichoke. My name's Rachel and today I'm going to give you another little update on how we're doing after thyroid surgery. I had thyroid surgery in 2020 after being diagnosed with Graves' disease. It meant that my thyroid was just going to keep growing and growing and growing until it was removed all the way. So my options were to either have surgery to remove it all the way or to have radioactive iodine, which maybe some of you know about, to just kind of kill the organ, and then it would hang out in there. We were trying to get pregnant for a couple years, found out that I had some thyroid problems, and that's why we couldn't get pregnant. Obviously, that all worked out fine. And so we decided to have surgery so that we could just move everything along. If you've seen some of my other videos, you've seen my post-op videos that talk about what to expect after surgery, which I will link here. And there's also videos that talk about how to advocate for yourself as a patient, which I will add here. So in my last video, I talked about a couple things that I want to touch base on here. One of them was hair loss, which was all back to normal 2 years ago when I recorded the last video, and it is still normal, healthy, fine. I have no hair loss. That has all been resolved. My scar has healed completely. I'll try to post a video here with a closer image of it. I still try to have the habit of putting sunscreen on my scar when I put sunscreen on my face every morning, but I don't have to worry about that too much either now that it's been 3 years since surgery. I'm still taking Synthroid every day, of course, like I will for the rest of my life. I used to take 175 micrograms daily, but now I take much less, and that's because after pregnancy, I have not been working out as much, so I've lost a lot of muscle, and that affects how much thyroid medication your body needs. We had a healthy baby and we had a second healthy baby, so that's wonderful. Synthroid is safe while you're pregnant and while you're breastfeeding, and I talked about that in my last video as well. We're really lucky, people who have to take thyroid medication, because thyroid medication has been out for a really long time and it's very safe. You can take it with lots of other medications. You can also breastfeed on it. So there are a couple things to know about when you're pregnant. You'll need to take your labs more frequently, so about once a month, and often when you're pregnant you're getting labs pretty frequently anyway, so they just kind of tack those on. And because your weight is fluctuating while you're pregnant, hopefully you're gaining weight, you will have to also titrate your dose and adjust that. So for example, even though I took 175 micrograms most of the time before pregnancy, while I was pregnant I ended up needing to take 225 micrograms. As soon as you're done being pregnant, you go right back to your pre-pregnancy dose. So for me, I needed to retake my lab draws 6 weeks after giving birth, and I still needed to adjust them a little bit, so I had to retake them again in 8 weeks. Now, even though everything is normalized, I'm still going to recheck them in about 3 months just to make sure that everything still looks good. The other thing that I was told to do while pregnant was to get a 3rd trimester ultrasound on the baby, just to make sure that there was no goiter or enlarged thyroid on the baby. Yeah, we didn't have that problem either time, thankfully. One of the other things I talked about last time was calcium, and that is something that I'm now on for life. I'm not as good at taking it as I should be, but that is a really important thing for women especially to take daily, because we are more at risk for having osteoporosis or other bone diseases due to lower bone density. My energy levels are normal. Of course, I'm taking care of babies, so I'm tired all the time. Haha. When it comes to my thyroid, my energy levels are completely normal. I don't have any symptoms when it comes to my thyroid disease either, except for when I'm titrating my dose for Synthroid. When I'm taking too much Synthroid, I get a little bit hot. My heart has a couple small palpitations. I feel really hungry and that I can't get full. That was something we noticed after giving birth to our second baby. And we had to adjust my dose so that I'm taking now a lower dose. And that's because I've lost some weight since pre-pregnancy. So thankfully there's not that much to update you. Life is pretty normal after having my thyroid removed. Basically, I just need to make sure that I take my medications every morning and that I touch base with an endocrinologist about once a year, or if I'm having any symptoms. Last time I gave some tips on what to do right after surgery and what some other people had told me was the most helpful advice I gave. And this time I thought I'd give you some tips on just living with thyroid disease, especially after having your thyroid removed. One is to make sure that you have extra medication with you if you're traveling or going on vacation, just in case plans don't go the way you think they will, or if you're kind of stuck somewhere overnight. I know that plenty of people have had last minute changes in their travel plans, or you get stuck in an airport overnight. So just make sure that you take maybe an extra week's worth of medications with you. My next tip is to find a provider who's willing to message you by either MyChart or another charting service. Even email. My doctors here in France use email to get in touch with their patients. Having a provider who's willing to contact you or be in touch with you if you need them is very powerful, and especially if you're starting to have some symptoms or going through a breastfeeding journey or a pregnancy journey, it's really nice to have a provider who's willing to communicate with you like that. My next tip is to be aware but not alarmist when it comes to symptoms. So if you start to notice that you're getting really hungry all the time, or maybe you're putting on weight or you're losing weight, just to be aware of those things but not alarmist. It's expected that you're going to need to adjust your dose throughout life because our weight just fluctuates due to lots of different things. Another tip is to take the pills you need in the morning with a glass of water and just put them right on your nightstand or right next to your bed so that as soon as you wake up in the morning you can take those. Because if you're like me, you wake up looking forward to breakfast, and with Synthroid, you really have to wait at least 30 minutes, if not up to an hour and a half, to take other pills or to eat breakfast. I've gotten clearance from my doctor just to wait 30 minutes, but that has made a really big difference for me, is just to take my pills as soon as I wake up in the morning so that I can kind of start get the morning going. Another thing to be aware of is that while thyroid medication is really safe and can be taken with other medications, you may have to adjust your dose based on what medications you're on. It's really important that you talk to your endocrinologist as you go on other medications, or that the doctor who's putting you on these medications has a really good understanding of how it interacts with your Synthroid. Thyroid disease can run in the family, so if you have thyroid disease and you have little ones or you have grandchildren, it's really kind of you and important of you to tell them. I had thyroid disease in my family, but I was not aware of it, and it would have been great if we could have screened for this disease earlier in life so that it didn't come as such a surprise for me. Finally, my last bit of advice: if you have thyroid disease, it can be managed and you can have a normal life and you can have a healthy life even after getting your thyroid removed. I'm so grateful that my videos have touched so many people, and I always try to read through all of the comments, even if I don't respond. But there are so many people who come to these videos with a lot of anxiety about an upcoming surgery or what life is going to be like after getting their thyroid removed. I was the same way before surgery, very anxious, wondering what life would be like, if I'd be able to get pregnant, if I'd be passing on some illness to my children. And I just want to encourage you that you can have a very healthy, happy, normal life even after getting your thyroid removed. That has been my experience. I have no regrets. I'm so glad I got my thyroid removed. I'm honestly so much more comfortable than I was when I was experiencing all the symptoms with thyroid disease. I have healthy babies, and I'm a healthy person. I can do everything I want to do. If you can find a healthcare team that is skilled, communicative, patient, and compassionate, you have kind of won the lottery when it comes to managing thyroid disease. Good luck to you. Please let me know if there's anything I didn't answer that you'd like to know about. You can always get in touch with me with the links below, including my website, happyartichoke.com, or any of my social media handles. Have a great day.